Well, good morning, everyone, and welcome to another edition of Brew with the Crew. That's right, Brew with the Crew. So excited to have Ashley and Alex. Of course, every week we're here, but the most amazing and special person is Dr. Susan Wood. Thank you for joining us this morning. Every Tuesday, we join together with centers of influence, business owners, and really talk about everything that benefits us as a community and topics that are really that really touch all of our lives. And so Dr. Susan Wood is the owner of Physical Therapy in Motion in Franklin. Ashley Gaylor is going to be introducing her further, but super excited to have you, Dr. Wood. Thank you so much for joining us this morning. If we could really quick, Ashley and Alex, if you could introduce yourselves, and then Ashley, you can take it away and we get this thing started, because I'm super excited to learn more about physical therapy, because it really touches every part of our body. And a lot of times we don't know why we're aching or why we're, whatever's going on. But physical therapy plays a very important role, no matter what industry that you're in. So Ashley, or actually Alex, we'll go with you. And then Ashley, you can take it away.
Sounds good. So my name is Alex Okagu. I work in the technology sector. Love technology and entrepreneurial in those pursuits. I also like the arts and entertainment. I met Josh and Ashley while volunteering for a food box program that Break-Thru Nashville was hosting. A lot of our priorities aligned, and we decided that we wanted to really start trying to impact the community with programs and opportunities, as well as meeting professionals in the area to do the same with. So that's a little bit about myself. Looking forward to our talk this morning.
Yeah, that's good. Hi, Ashley Gaylor, New York Life. I am just a community servant. Started with the food box program at Break-Thru Nashville, which we are all on the board of. Alex and Josh and I became buddies during that process and colleagues, and we love to talk to each other. So we said, hey, why don't we just start doing a podcast Zoom call of us talking like we always do? So that's where we're at with this. And hopefully it puts content out there that may help people. So that's our main goal, is just to try to help folks in any way we can. So whether it be take shoes and distribute them out to people that need shoes, or do a podcast Zoom call to put some information out there that may help somebody, that's what we're here for. So with that being said, I want to introduce Dr. Susan Wood. She is owner of Physical Therapy in Motion in Franklin. Outstanding person, great personality, terrific bedside manner. And I can speak to this because she is my physical therapist. So I'm kind of biased because I will touch on my story here in a little bit, how she helped me, but she literally changed my life, and that I'm not making that up. So without further ado, I will introduce Dr. Susan Wood, and she can talk a little bit about herself.
Well, thank you for that lovely introduction, Ashley. So like you mentioned, I own Physical Therapy in Motion. It's been my baby over the past year or so. I've been a therapist for about 11 years and been treating the general orthopedic population for that entire time. My primary focus has been mainly on the spine. It just tends to be the neck and back tend to be two of the biggest areas that people struggle with discomfort and pain. So moved here about 3 years ago from Central New York, the Syracuse area. And we went through some changes with my previous employer, and I kind of decided that I wanted to really be able to provide a high quality experience for my patients, one where they felt like they had somebody that was really cheering for them and rooting for them, and I was able to work with them as a team and follow them however long they need to be followed. For Ashley, for example, with Ashley, every once in a while we'll just kind of touch base even after he's been discharged several months and just check in and see how he's doing. And, opening up my own practice has really allowed me to do that. One of the other things that I really and strongly compelled to do is just to learn more. So in 2017, I received my certification in the Mackenzie Method, which is a widely used physical therapy assessment process that is for the orthopedic population mainly. And it has been pretty much a game changer for me. It has allowed me to, like Ashley had mentioned, like he felt like I changed his life. That type of assessment process has allowed me to teach and to educate in ways that I couldn't before, and really help people in ways that would transcend to after they were done with therapy and giving them really true solutions to their problems. So really excited to be here. Thank you so much for having me on. And yeah, that's a little bit about me.
Oh yeah, thank you. Good stuff. Okay, so I'm gonna get right into it here. This is I'm dying to tell my story, but I'm gonna wait. I'm gonna ask this question first because it's so good. But I mean, it is. We're building up the suspense, kind of like
There
they do before they go to commercial break, and you got to come back, right? So
Crescendo.
you talked about the spine. We talked about obviously back pain. So back pain, why does it seem to be the biggest problem and cause the most disability in the world?
Well, back pain seems to be a huge trigger because we spend a lot of our time in the same position with our spine. And what I mean by that is that, you know, one of the two biggest predictors of low back pain is a high frequency of bending and poor posture. And really, what do we do with our lives right now? A lot of us are sitting for work. We're sitting in office chairs, and the average person's going to bend over 2,000 to 3,000 times a day. Now, it doesn't mean you're bending over to touch your toes, but just think about it. You are brushing your teeth, you're getting dressed, you're doing laundry, you're fixing your dinner. Everything we do, our whole world's in front of us. And so that lends itself to a lot of repetition in that position. And then when we're sitting, we kind of tend to sit a little slouchy, and that position is the same position as flexing. So we just hang out in the same position all day long. And without reversing that, you can get this accumulation of stress. And sometimes it'll build enough to where you're stiff or uncomfortable. And sometimes it'll build enough to where you are in severe pain. And it's actually interesting. It's not uncommon for somebody to come in and say, like, you know, I don't really know why I started hurting. Like, now it's out of control. Like, it used to be that I would get a little stiff here and there, and now most of my day I'm uncomfortable. So by and large, most of the time, it's just this accumulation of stress, and we're not really taught and know how to take that stress off our spine.
All right. Okay. So with that being said, and I think that everybody hears a couple of different phrases anytime they may or words, acute symptoms versus chronic symptoms. What are the differences there?
Yeah. So in an acute situation, you might have a very rapid onset of pain. So like, for example, you may be in a car accident and you get hit and you feel an immediate pain. Or let's say you've been working out in the yard and you have been gardening and you go to lift something, your fertilizer or something, and you have an acute onset of pain. So when something like that happens, oftentimes you have to be a little bit more cautious, I guess, about how you're moving, because it's been acute, but it doesn't mean that it can't respond quickly. And we'll kind of touch a little bit on that later with Ashley's story. But I would say that's a situation where you could be totally fine or seemingly totally fine, and then bam, you start to feel it. Whereas a chronic situation, it could be somebody who's like, you know, every morning I wake up and I feel like I I'm stiff and I'm a little uncomfortable. It takes me 20 minutes. I walk around and I'm starting to feel better, but this is like Groundhog's Day. Every morning I feel stiff and sore, or you might even notice it throughout your day, but those are a lot more stable. Like you've had them for years and they're not, you could be probably a little bit more aggressive with their symptoms or their movements and your examination. Or you can have people who have just on and off symptoms. Like I could go 3 months and not feel anything. And then bam, I'll notice like it starts to turn on or build, which is Ashley. So you kind of can fall in different buckets, but what's really cool is that most people are going to respond. So most people have what we call mechanical pain. Something's just not in the right spot. Your joints are not moving right. And usually it's because we haven't moved them and out of the same position for long periods of time. It's that same stress that we put on our spine. And as we start to work together, oftentimes your body will tell us like, hey, it needs that movement. And that movement starts that healing process. And from there, we just really try to create a good healing environment. So we'll address like what kind of activities during your day bring this on. How can we modify that? If your chair is a problem, we got to fix how you're sitting. Because if you do 100 exercises during the day, but you spend majority of your time sitting and we don't fix that part of it, you're going to be frustrated and you're not going to see the results that you want. So I know I'm kind of veering off, but when it comes to acute versus chronic, subacute, they all can be addressed. And they all can have really good prognosis. We just have to kind of slightly tailor how we initially stress you.
Gotcha. Well, all right. So that answers some questions about that. So let's talk a little bit about how my situation plays into this, and it's kind of a testimonial as well, if you will. But Dr. Wood and I connected on LinkedIn. She's active on LinkedIn. Got a great page there. We connected for business, and then we got to talking, and I was like, I've got this back issue that I've had for years. And when I say for years, I mean, I'm 48. I'm talking about since my mid-20s. I used to do very physical work for a living, and I always had this spot in my back that I would tweak a couple, 3, 4 times a year. And when it happened, I would go down, like literally. I was crippled up. I would have to sit in a chair with pillows behind my back. People would have to help me get up and down. I could not get out of bed. When I went to bed at night, in the morning was the worst, because I couldn't even hardly get up to go to the bathroom. I had literally been stuck on the floor before and couldn't get up, right? Because I didn't want to face the pain because it hurt so bad. So I dealt with this for years. Okay. I just thought it was the way it was. Anytime it happened, I went to a doctor. They just would always try to give you, tell you to take ibuprofen or whatever and put an ice and heat, but that never happened, but never fixed it. So Dr. Wood and I were having a conversation. She said, and I was talking to her about this. She told me to come into the office. I wasn't having an issue when I went into the office. I was fine. We went through the exercises. My back was a little tweaked, but it really wasn't tweaked. So we went through the exercises that she showed me. She was showing me everything to do. That was one visit. First in my mind, I'm going to play my skepticism card. I always thought of physical therapy, just being honest, that it was something you had to go do. You had to be there. You had to do it 2 or 3 times a week or whatever it was for a long time to get over your situation. So that was always, when I went. But when I went and she told me, she goes, I think we can get you cleared up in 2 to 3 sessions. I was like, wow, wait, okay, so that's off the table. I'm like, okay, that's good news. Show me the exercises. The exercises felt good when I was doing them at the time. I was like, oh, I can do this. And anyway, and a part of my get my wellness journey to get better with my back was following her instructions. Okay. So that's key. And I can attest to that, is you need to follow your doctor's advice, right? You need to do what they lay out for you. So with that being said, my particular situation was exercises every morning as soon as I get out of bed, that for my back, to get it loose. Now, after I went through my sessions, I learned all my exercises. My back had never, triggered, and I was in good shape. So I really wasn't doing my exercises, right? Because I was like, my back's fine. I don't know that I think that I'm doing good. So there's my first point. I didn't follow doctor's instructions on this, right? So, okay, so I go on vacation. I tell her I'm going on vacation. She's like, hey, need to make sure about your back, whenever you're riding in a plane or whatever, and told me exactly what to do. So I had a great flight. Okay, so we get on family vacation, and I'm taking out the garbage, and one of the cans gets kicked on something. I bend down to pick it up, bam, threw out my back. First day of vacation, right? This is literally 3 weeks after I left the office. Okay, so what I did is I immediately went down. I took about 30 minutes and did my stretches. I kept doing them on and off through the whole day, and it immediately let go. Like I didn't have any issue whatsoever. Okay. I pick up the phone. I'm on vacation. It's a Saturday, and I text her to tell her, and I mean, she texted me back, on the weekend, and we had a whole conversation about it, about how I cannot believe that those exercises actually stopped it from taking me down, because I was going to be devastated. It's my first day of vacation. So that is a true story. That happened. Okay. And then and my point to the exercises, to keep doing them. After that day, I learned I did my exercises every day in the morning since then, because I don't want that to ever happen again. And so I have been doing my exercises in the morning. It becomes a part of your normal everyday routine. Those exercises, I get up, I do my exercises, and then I brush my teeth. Like, every day we do the same thing. It takes me about 5 minutes now. I've got it down to 5 minutes where I can get my good stretches in. But that is my story of my introduction to her, and how literally those exercises she taught me how to do changed my life. Because anybody that's had back pain, that's had a back issue, knows what it's like to be froze up. I don't know if everybody's can be stopped like that, but if you can stop it in its tracks, that's what did everything to me in the world for me. So thank you.
You're welcome. And I guess to kind of just continue on that point, what I thought was really good about that story is that one, you reacted immediately. And that's like one of the things I'm most passionate about, is teaching you how to react if something doesn't go perfectly as planned. Because chances are at some point you may have an issue again, but it is going to be very short-lived, like your situation where you were like, oh no, I tweaked it, and within a day it went from it could have been a full-blown flare to it's totally fine. I can enjoy my vacation. And that's the pretty amazing part about the body, is that it is really good at healing itself when we give it the right stuff. And that's my job, is to figure out, well, what does your body need? And it tells you. It, like Ashley said, it literally immediately starts to take it away. If we find that right movement for you. And most people fall in that category of rapid responders. We can figure out why you're stuck, you're jammed. That's my job, is to figure out, well, why are you hurt in the first place? Is there something we can do to reverse this process? And if we do, then you go home and you explore it and you work on it. And it's actually not as complicated as what you think. I'm not giving you a lot of different things to work on. I'm helping you make your environment better. Like, what's perpetuating this problem? Because if you, like I mentioned before, if you sit terrible all day long and that's one of your triggers, If you don't fix that, you're going to be frustrated. So we fix your triggers, we address those, and then we figure out what is the one or two things that your body really needs to make sure that it's feeling better. And typically when we don't feel good, we don't move well. And that's where finding what movement or exercise your body needs, that's why it's so important. And when you do it regularly, you will be able to catch any type of possible whisper or warning sign that something could be coming on. And now Ashley's in a good place where he's doing it regularly. It doesn't interrupt his life very much. And he now knows, okay, this is what my normal feels like. When it's not feeling normal, I'm going to increase the frequency of this. And then I'll get right back on track. And so I remember giving you a call and being like, okay, how are things going? What's going on here? And just kind of making sure that you knew, stick with the plan. You're going to have to be really good all day with your exercises, really avoid doing things that are triggers. And, the next morning you followed up with me and said, hey, I'm perfect. And I didn't have any trouble getting out of the bed in the morning. So that's, it can really, you can have some great or quick recovery if you just attack it right away. So yeah, it's pretty cool. Fun stuff.
Dr. Wood, I had a question.
Yeah.
So I know that weight plays a big role in back problems as well. I know that myself, I used to have back problem or back spasms, and every so often I will get a back spasm. And I know early on that I would put like a cold pack or an ice pack on my lower back, and the pain would subside. I don't know if it like numbs the nerves in my lower back, but I was talking to just recently, probably a few months ago, my back was starting to go out again, and it's probably one of the worst feelings in the world to have your back go out where you can't get out of bed, or you can't, like, even if you just move an inch, it's just the pain just shoots up your back, down your leg. And one of the exercises that a friend of mine, she's a physical therapist, doctor of physical therapy as well in Franklin, she was telling me to like lay on my stomach and then like arch my back up and then arch it down and bring it down and arch it back up, and you're pushing those the discs back into place. But what is the difference between, you go into Kroger or you go into Publix or Walmart, you buy Icy Hot, or you buy these, what's the difference between a cold pack or ice pack versus like a heating pad, and which one works, or which one maybe it feels good, but we really shouldn't be doing that because it alleviates the pain for a moment, but it really doesn't do much down the road. I was always wondering that difference between an ice pack and a hot pack.
So, when I think of ice pack, I think of like an acute injury, like an ankle sprain. There's a lot of swelling, inflammation in the area, and that ice really helps to draw some of that inflammation out. When I think of an acute back injury where you're like, it's locking up on you, I would probably veer towards the heat if you're going to do it. But I would actually just start with exercises. If you know what exercise you need to do to get yourself out of that by and large is going to be way better than adding any type of heat to it, because the heat is going to be comfortable, but it's not going to fix your problem. And most people, I actually just had this conversation with the patient yesterday. He said, I put on 15 pounds. The guy's not a heavy guy over the past year. Do you think that's playing into my problem? And I said, no, it's not. You had this problem when you were 15 pounds lighter, right? Yes, I did. Okay, not your problem. This is a movement problem. Your spine isn't moving right. when we get it to move right, you feel fine. It has nothing to do with how much you weigh. And so I think sometimes people constantly think, well, I have to lose weight in order to feel better. But oftentimes that's not, I don't believe that that's the case, because you can be tiny as can be and have the same problem who is 100 pounds heavier. Because oftentimes it's a movement, like you are locked and jammed. And when you get that movement back, you start to feel better. And then when you feel better, you're more inclined to want to be able to lose weight. If that's a goal of yours, if you want to feel better, of course, it's less stress to your spine as far as how much load is going through it. But is that going to take away your pain? It's typically not. It's going to be you're moving better, and that restriction that you had is now gone, and therefore you feel better. Does that answer your question? Sorry, I think you're on mute.
Really quick, I want to introduce, I'm glad that
Yeah.
Dwight Jamison hopped on. How's it going, Dwight?
Morning.
Dwight
morning.
is a nonprofit leader up in Clarksville. Him and Latanya, they have such a huge impact in the community up in Clarksville. They touch so many people's lives. Had an opportunity to partner with them with the Food Box program, but Dwight definitely a giant in the nonprofit world. And so thanks for hopping on. We're talking with Dr. Susan Wood. She's the owner of Physical Therapy in Motion in Franklin. Just some great topics of discussion. Dwight was prior military up in Clarksville. And so if any questions that you have, feel free, Dwight, to ask Dr. Wood. But I just wanted to get that in there really quick. Thank you, Dr. Wood.
Mhm.
Okay, so we've touched on it a little bit. This kind of answers, I think that some of the things you've already talked about is what sets yourself apart, okay?
Mhm.
Because I don't know many doctors that are going to text you on a Saturday. I'm just saying, but well, let's talk about what do you feel like is the biggest difference between your company, Physical Therapy in Motion, and traditional therapy?
So thank you for asking. I feel like one of the biggest differences is I am really trying to help you understand why you're hurting, right? For you to feel like you become kind of your own assessor and your own therapist, if you will. Because when you can understand a pattern, and that's what I help you draw out, like there's this pattern to this, and unless you start to break it and interrupt it, you're probably going to end up in the same situation. So if we can understand it, and I can help you understand your own body, then you are going to be able to maintain your gains and then work on preventing it. And then the prevention piece is the biggest thing and we've talked about this, the biggest thing I'm most passionate about, because there's going to be a situation where you take out the trash, it's super early in the morning, and you feel it get tweaked. And maybe it was because of all the travel the day before. Sometimes that happens. You get this accumulation of stress, and your back responds. And so, but if you understand what is normal to feel, when your spine's feeling good, this is how it feels. When it's starting to feel off a little bit, you know exactly what to do. And when it's in this full blown, like, oh my gosh, I just really did something bad. If you would address it right away, it becomes a day situation, a couple days, not okay, I'm going to be laid up for my entire vacation, and I hope that I can make it home okay, because that's a long way to go home. And you know that sitting is a big trigger of yours. So I think just kind of really being your biggest cheerleader, helping you understand what's going on, how you can keep yourself healthy, what to do if it's not right. And really, I love to like keep the conversation going, like staying in contact. If there's ever anything that somebody needs, if they need a little like tune up or question of like, hey, this just happened, am I on the right track? It's always something I enjoy. I love feeling like somebody has access to high quality information, that they feel like I don't need to go run to maybe the doctor because I've done a little tweak. I know that I can work through this, and I have somebody who knows my spine or knows my knee, whatever the situation may be, well, and I can have them, make sure that I can get myself through this issue.
Yeah, absolutely. All that. And what is key to me in everything you just talked about is following the process, right? The first I've tweaked a few times, but and I know what's going to do it, but I try to do it anyway for some reason. Like the garbage at the beach was that was an accident. Okay, so but I learned I wasn't doing my exercises every morning because I was like, fine, my back hadn't tweaked since I started seeing her. Since I learned exercise, I was fine. So I'm like, I don't need to do these. She told me to do them every morning when I got up, and I'm like, I'm fine, right? So after I hurt my back, and then this is the first time since I seen her that I actually had the issue that I went to see her for. So I was like, I've been doing them ever since. I went to the gym a few weeks ago, and I did it again, doing the same exercise that she told me I probably shouldn't be doing. But I did it again, tweaked my back. Typically, if I did it before, I would have had to leave the gym, go home, and then wait for the wrath of the morning to set in after laying in bed all night. But I was able to get down, do my exercise, knocked it out, continued my workout, never had an issue. So I think that and then I gave her a call. I was like, hey, you're not gonna believe what just happened. And I believe on my end, that's what sets you apart from others, is your open communication, wanting to hear from your patients, wanting to coach them through things, so, and that's to me, that is one of the reasons why your practice is so top notch. So all right, where can people go to find a link for your business? And also, I think you've got some general videos out there that talk, that show a little bit about what you got going on. Where can people find that stuff?
Yeah, so you could go to my website, pt-inmotion.com, to learn a little bit more about my practice. I also have a lot of videos on YouTube that, like Ashley had mentioned, this is meant to provide some kind of basic education. There's some exercises on there, just tips for how to make driving long car rides comfortable, things like that. So that would be under Physical Therapy in Motion on YouTube. I'm also on Facebook and Instagram, and all those videos are also on Facebook and Instagram as well. And that is at PT in Motion TN, or you could look up Physical Therapy in Motion. You can contact me through my email, which is susan@ptinmotion.com. I also do virtual and in-person visits. So, that is available for people who are not close by. And oftentimes people can get just as good a results working from home as they can from being in the clinic. As when I work with somebody, I'm kind of the guide in helping you figure out what kind of things that you need to do to heal. And so, so we can do that virtually, which is really cool.
All right. Good information. Good information. Also, let's see, it's Physical Therapy in Motion down in Franklin. So I would suggest anyone seeing this content, whenever you see it, absolutely, if you have an issue, reach out to Dr. Wood and have a conversation with her, right? Doesn't hurt anything to have that conversation, especially if you can do things virtually. Like I said, she got me cleared up and totally changed the past 20 years for me. And I can't stress that. I can't say that enough because it is so true. With that being said,
here we
Alex,
go.
Josh,
This your Facebook page right here, right?
That's right.
This is it. This is
Yeah.
the Facebook page. We got so
Ashley, I need
here,
you to do. Sorry. Go ahead.
so we got reviews,
Mhm.
Services, homepage, contact us.
Oh, I never
We
left that review.
I know. I was just gonna say, Ashley, you know you owe
Oh
me.
man, that just made me thought I'll do that today.
I'll send you the link.
Oh. Yeah, you did. And I totally
It's okay.
I
I'll
totally
No,
resend
no.
missed on that one. I
What
apologize.
is
I dropped the ball.
no,
So
you didn't.
okay.
No, you didn't, because that's why us three are here. We got each other.
yeah.
So Dr. Wood, is there something on your website or on your Facebook page that you'd want someone to maybe check out, something that would they could click on?
So scroll down. I think there's some I think there's like a tip section. Keep going down. I think it's below. So here's in the video section. There's some pretty good content of, like I mentioned, the kind of tips that I like to share with people. So that's something that I would direct. That's my daughter. She's 2. So yeah, the video section has a lot of great tips for
gardening tips.
So there's lots of different things that we cover, and the plan is to make that even to grow that quite a bit. So yeah, that's what I would check out. Like Ashley said, typically I will talk with somebody for, I don't know, 10, 15 minutes as kind of like a discovery call before I see them, to make sure that there are a good, oh yeah, and check out the reviews. It's a good way to kind of get a feel for the types of things that I treat, how people felt like they, that their lives were impacted. I think it's a good indicator, because, that's where you really kind of learn about how people felt and how people, experience the therapy. So, yeah, I check out videos and the reviews. There's some good content there. I'm working to grow like my blogs and things like that. So more to come there.
And then they can just go on, contact you, enter their name, email address, phone number,
Yeah.
type you a message. And then, so let me ask you this. This is I don't know, maybe it's a question I shouldn't ask, but what is the difference between physical therapy and chiropractic?
I knew you were going to say that. Well, honestly, part of it depends on the type of chiropractor or physical therapist that you are. Okay. So, I'm certified in the Mackenzie Method. I'm more of a mechanical therapist. I really try to figure out, why are you hurting and what do we need to do to get you out of that pain? And there are chiropractors that are certified in the Mackenzie Method too, and they actually practice almost identically to how I would practice. So in that instance, they're very, very similar. But I guess I'll speak from my end. My kind of end goal when I see somebody is to have them understand their body, know what's going on, and have a reliable exercise and treatment plan that they continue on. It's not very invasive to their life, but they know that this is what they need to do to keep themselves healthy. So it's really trying to give patients their own toolbox, give them their, make them have a high self-efficacy, like I can handle this, I can do this, I understand what's going on. And I don't know if that's the case as often when you're getting treated. Even in some other physical therapy disciplines too, they're not maybe giving you that kind of information as well. So when it comes to a chiropractor, I guess I'll speak from my end, and I don't know if they cover a lot of the prevention piece.
Because I know there is, there is a difference between, in my view, between a chiropractor and a physical therapist. I mean, each one has their specialties, and not that each one maybe is, I don't know, maybe better than the other, but it all depends. Like you said, each one has their specialty and what they focus in. And when I think of chiropractor, I think of, maybe cracking my back or my neck. And when I think of physical therapy, I think of really more in-depth, more than just maybe a back adjustment or whatnot, but more the long term. And I guess chiropractor is the same, but just physical therapy, the physical therapy is really the therapeutic of your body, and really just so both are really, really good. But the physical therapy part, I think the doctor, doctors also, there's physical therapy in hospitals, right? Physical therapy for elders in nursing homes, physical therapy, and plays in a lot of different spaces, especially in the medical field. Versus chiropractor is great, but you got to go to a chiropractor office, versus physical therapy can be right inside a nursing home or a hospital or something right there. And they're like really, really connected. So that's just kind of what I think.
Yeah. And I think, so I actually recently had a patient who was struggling with some shoulder issues, but we actually found out that some of, and we don't know yet if it's fully all coming from his neck or partially. It's somewhat too soon to be determined, but he's having really good success now with improving his pain in his shoulder by us actually treating his neck. And he said, well, I've been adjusted. Like, why didn't it fix with the chiropractor? And I said, well, what I'm giving you is something that you're doing multiple times a day. You've got to get your movement back. And we're also creating this good environment for healing. We're fixing some triggers of yours. And so maybe that's why, is because if you get adjusted, yes, it feels good. And you opened up some space and you had some improvement, but then you didn't have anything to go home and say like, okay, this is improved. Now I got to keep improving. And that's where that's where he wasn't feeling like he was making the right gains, even though he might have been somewhat on the right track as to the source. It just wasn't moving forward because he wasn't able to do something throughout his day, which is often necessary. You need to, when you're coming in to see me at first, typically you're prescribed something to do multiple times a day, and it takes a couple minutes to do each time. So it's not very time intensive, but that's what your body needs. It needs a consistent interruption of an irritation and be fed lots of good stuff for it to heal. And so that's where hopefully there's that's why my patients tend to do a lot better, is because they're consistently interrupting that cycle of discomfort.
That's incredible.
So on my experience, having my back issues for over 20 years, I have been the chiropractors. Everybody's got their own thing they do, right? And I've had some great chiropractor visits. Okay, but when I went for this particular issue to the chiropractor, it always made it worse. I went twice, and I'm like, I'm never doing that again. I couldn't even hardly get up off the table afterwards. I mean, literally had to be helped up. Okay. Wow. So, and I'm just saying, when I went full blown into my back issue, like I got massages, I've been to chiropractor, I went to the float tank before, the salt bath float tanks, all those. If I got down on the table for any extended period of time, I was done. I couldn't get up. And that's, and like I said, the chiropractor visits, I went twice. The first time, and I gave it a shot again years later. Same thing happened. I was like, okay, I can't do this. Not that the treatment wasn't good. It's just that when I was down, laid in a still position, doing anything, even though you're laying down, I couldn't, my back would freeze up and I couldn't get up. Now, after learning what I've learned, that's the difference is the stretches. you doing it yourself, not somebody doing it for you. I think that's the key too. And then breathing out at the top of your stretch. So these are all things that people can learn to do, but that was my experience with my situation with my back issues, that that this is the only thing that ever alleviated. I mean, not just alleviated, this is the only thing that changed it, totally flip switch. So
Hey, Dr. Wood, really quick.
Okay.
So I work in the bank. I sit down the majority of the time. I get up, I go to the copy machine, or I get up and, I got my tellers, my bankers. But for those of us that are in the office and we're sitting down the majority of the time, what are some, like, I know, sitting up straight, making sure that your posture is there, making sure when you're typing on the keyboard, what is maybe one or two small little exercises that we could do on a daily basis that can make it small, but it can make a huge difference down the road for those of us that are in the office space or sitting down majority of the day?
Sure. So I would say the first thing, I'll give you kind of two of my two tips. The first, even though I need to sit up straight, right? That's a good idea. And unless you actually put some lumbar support there, it's likely not going to happen.
Okay.
Because I have one right now as I'm sitting. This is just a simple little lumbar roll. So I scoot myself to the very back of my chair, and then I put it in the small of my back. So if you now, I can't really show you here. So essentially, if I take here my spine's in neutral, right? Like I'm not flexing and I'm not arching backwards. Okay, it's just a normal position. But when we sit like this, right? Slouchy. So if I put something here, it's going to create a neutral position. And those discs now have a more equal compression through them. It's not asymmetrical and not stressing your spine in a negative way. Okay. So the first thing you do, if you fix your posture by actually putting something there, and then when you have it, you have to scoot yourself really close to your desk, because if it's behind you and you're reaching, you're still in that same position. So you need to fix your posture. Oftentimes that'll fix half the problem. You just got to sit up better, because that's one of your main triggers, often for people who sit for long periods of time. So that would be one of the biggest things I would do as far as your setup, and then actually just trying to reverse it, putting your hands on your hips and just reversing that stress throughout your day.
Those are two big ones.
Yeah, every couple hours I would bend yourself backwards, because now you're trying to create a neutral position, but then you're taking it further by trying to take that stress off that would have happened. Well, I guess, and then also just make sure you don't sit for more than like 45 minutes at a time. You just got to stand up and break the activity. Yeah, those are my two biggies.
That's one thing I've been doing different. I get up I make sure I get up every hour and walk at least 250 steps or so. And then I'll knock out a couple of, a couple of press ups, and then a couple of back bends, and then I go back, so that's really
great.
helped my day too. So
That's awesome. That's great.
Well, Dr. Wood, thank you
hey,
so
there's Ellie.
much.
Happy birthday, Ellie.
Yep, today is Ellie's birthday.
Aww.
Happy birthday. She's our little minion. She has her minion shirt on.
So she turns 3 today?
3 years old, yes.
Aww.
3 years old today. She loves
my
Peppa
daughter's
Pig.
name's Ella. Oh, lovely. I love Peppa.
Your daughter's
I have
name
an
is
Ella.
An Ella.
Yeah. So
An Ella. Yeah, she is the joy of our life. She loves Peppa Pig. Anytime I'm anywhere, she has to be hop in my lap, and she's very curious. But Alex, anything as we close up, anything you want to add or comments?
Just one quick question. I mean, as far as your practice, have you found that based on that office setting that a lot of people have to deal with, the work from home, the consistent sitting down, Do you find a commonality between particular issues that people are having, or is it usually going to be different based on the individual because there are so many different ways to sit or anything like that?
No, I think by and large, most people come in, they have a lot of their stories can be very similar. Sometimes the way we address them is, everybody has kind of a unique situation. So I will always make sure that we address yours appropriately. But a lot of people, and unless you're kind of, this information is being pulled out as a patient, and even for myself, it's really hard to assess myself if something wasn't going right. It's like, wait, what did I do? Why? Like for me, sometimes I'll get headaches if I have bad posture in front of my computer for a long period of time. And like every once in a while, I'll end up with a headache and I'm like, what just happened? And then I realize, oh my gosh, what have I been doing all day? And so I think it's my job to kind of help you pick out those patterns and those pieces and figure out, well, is this a trigger? Because you might not even recognize it as one. And then we create, I try to make sure that the things that need to be addressed, especially your main triggers, as we talk and figure that out, that they are. And then we make sure that, hey, once this trigger is off, now let's make sure you can get back to doing anything that you want to do and you're not afraid to do it, and it's okay. You can lounge on the couch for a little while, but right now you probably can't, like once you're feeling better, sure, that's fine. Just be good most of the day, So I think it's just kind of finding figuring out what's best for each person.
You got it.
All right, thank you. Well, guys, I believe this was a very informative morning. I think we got a lot of good content and good information out there for anyone who needs help. Right. Don't be afraid to give Dr. Wood a call at 615-905-1954. Physical Therapy in Motion in Franklin. You can find all of her content on all social media platforms. Be able to get to her on her website. I'm telling you from someone who has been there, if you have an issue, you've had it for a while and you're not sure, you've been skeptical about getting help, please reach out, just give her a call. It'll be worth your time, trust me. So, well, we're going to wrap it up, guys. I appreciate everybody coming on from Joshua and Alex and I. Dr. Wood, thank you so much for your time this morning. And we really appreciated the knowledge drop you dropped on us today. It was really good stuff. And we appreciate you doing our little show.
Well, thank you so much. I really appreciate it. This was fun.
Thank you, Dr. Wood.
All right.
I'm going to come see you. I'm coming to see you.
You should. I was going to say, Josh, I think you might need to schedule an appointment.
Yeah. You know what? Yeah, definitely. I will. Yeah, I will definitely schedule an appointment. Come see you.
Okay. Awesome. I love that. All right. You guys have a great one.
Thank you so much. We'll see you.
Thank you.
All right.
Take care. Bye-bye.